Hi, I'm Jeff Capizzi. I'm an HIV epidemiologist. I work in the HIV STD TB section of the Oregon Health Authority, and I was asked to talk to you today about our substance use centered syndemic and HIV and syphilis. I'm going to explain what the substance use centered syndemic model is and why it's important. And then I'm going to show you the increasing trend in drug-related causes of death, and then describe the impact of substance use on people with HIV and syphilis. Now, the Centers for Disease Control, the National Center for HIV, Viral Hepatitis, STD, and Tuberculosis Prevention, they say they've got 4 overarching goals, and that's to reduce the number of new cases, incidence of those diseases, sickness or morbidity and mortality, also reduce disparities and promote health equity, and achieve excellence. Well, nowhere in here is a mention of overdose or substance use. That's because it's not really in their wheelhouse. They do this prevention work, they do surveillance of those diseases, but their specialty and skill sets are not on the issue of overdose and substance use. Instead, when they talk about their priority syndemic, they look at what they know and then figure out how overdose and substance use work that other people do fit into their plans to reduce incidence and otherwise achieve their overarching goals. Now, a syndemic, it's defined as a population level clustering of social and health problems. It can be 2 or more diseases. It's a clustering of diseases that results in adverse disease interaction, biologic, economic, demographic, social, and behavioral, increasing the health burden of affected populations, right? So when you look at a syndemic model, what it does is it helps you figure out where your weaknesses and strengths are, who you might need to partner with, who are your allies, who has money. It also aids in effective policy analysis and planning, surveillance, interventions, evaluation, indicator setting, and monitoring. So when you see a syndemic model, and this one is developed by Jude Leahy. It was developed for a NIDA grant run out of Oregon Health Sciences University. And it is substance use centered. And it links to, and these conditions are issue ovals. It's the red dotted lines are links. So different levels of substance use are associated with overdose, morbidity, and mortality. Also, sexually transmitted diseases. So substance use increases both those infections, but also is related to comorbidity and the reasons why people die. We also see in injection drug use a relationship with hospitalizations due to skin and soft tissue infections, bacteremia, sepsis, endocarditis, osteomyelitis. So it's more than just a couple of infectious disease. It's more than just hepatitis C. Now, I am going to be talking about overdose, morbidity, mortality. And I just want to stop for a second and acknowledge that a number of people on this call have known people who've died of overdoses, known people who've died of these infectious diseases. And I'm going to be talking about numbers, but I just want to acknowledge that these are people, their friends and family. And while acknowledging that and trying to be sensitive, it's also important that we do what we can to reduce overdose mortality and the causes of death among people with hepatitis C and HIV. So I'm going to talk first about overdose. And what you see in front of you right now is a graphic of the number of deaths that on the yellow line relate to overdose surveillance. So this is kind of a proxy line. I looked at Oregon Vital Statistics death data once it was closed, November of this year. And what it represents is the underlying cause of death was poisoning. And in those situations where one of the illicit drugs, opium, heroin, other opioids, methadone, synthetic narcotics, that would be fentanyl, cocaine, barbiturates, benzodiazepines, or psychostimulant meth, one of those and this poisoning code, then you were added to this line. And you can clearly see that as of 2008, or even going back to 2016 or 17, we started an increase, which was dramatic. But there's another way to look at this, which are the greater universe of drug-related deaths. And that blue line represents those deaths where one of those illicit drugs was documented on the death certificate as contributing to that person's death. The difference between these two lines in 2023 was 393. And those 393 were mostly methamphetamine deaths that did get coded as overdoses. So that's can be a coding problem. It's a little bit more complicated, but still those people died of a drug-related death. What you're looking at here are drug-related deaths in Oregon overall by substance. And because methamphetamine and fentanyl are the drivers of most overdoses or drug-related deaths in Oregon, I'm kind of trying to emphasize those. And most of all, I'm trying to emphasize this blue line. That is where methamphetamine was documented on the death certificate, but fentanyl was not. And you can see it's been constantly increasing all the way back to 2010 and more steeply in 2017 and 2018. And then the blue line, the purple line represents fentanyl, where fentanyl was documented on the death certificate and methamphetamine. So if you add the end of the purple line in 2023 and with the end of the blue line, you see that we had 1,433 methamphetamine-related deaths in 2023. If you add the end of the purple line with the green line, which is fentanyl, but not methamphetamine, you can see that we had 1,289 fentanyl-related deaths in 2023. The red line represents all other illicit drugs. And while that line is going down because of decreases in heroin, other opioids, and methadone, it kind of conceals the increase that we actually had there too in cocaine-related deaths. Now, on the East Coast and as a country as a whole, we're seeing a decrease in potency in fentanyl due to drug enforcement practices, decrease in fentanyl access, but some of that decrease in the overdose death that we see, what we've seen on the East Coast, may also be due to not just decreased access to fentanyl, but increased access to treatment and naloxone. One thing that you know, supply and demand, is that if fentanyl access decreases, something might step in its place. And that may happen by the time we start seeing the effects in 2024 and 2025, but that's hard to tell. One thing that we do know is that as fentanyl potency decreases, this may increase the number of people injecting drugs to get a more potent high, and that thereby increasing the probability of overdose, increasing the probability of HIV infection and other infections. And one thing you can see in the upper right that relates to this is the number of number of deaths due to, in the orange line, methamphetamine, and the gray line, fentanyl. I'll make this bigger. Oops, can't make it bigger. One thing you can tell here is that there's separation between the gray line and the orange line. And that may be the decrease in fentanyl-related overdose that we might be seeing after May of 2024. It's still too early to tell for sure, but that would be consistent with what we're seeing. I provided a couple links here if you're interested in a really good story that describes why we might be seeing this decrease in overdose. And I've also included a link here which takes you to CDC projections on drug-related deaths or overdose in Oregon or by state in the country. Now, I mentioned hospitalizations due to conditions or infections related to injection drug use. Now, we did a study back 2008 through 2018, which saw a rapid increase in the number of people being hospitalized for injection drug use related infections. And then more recently, injury violence prevention. Liz McCarthy has been able to show that the numbers of hospitalizations have been increasing again since 2021. You can see that blue line increase from 1,500 per quarter, not per year, but per quarter, and in third quarter 2021, and it's getting close to 2,000 by the second quarter of 2024. That's not good news. Now, I'm the HIV epidemiologist, and one thing I look at every year is the underlying cause of death among people with HIV. And each year, the number of deaths due to HIV disease has been going down. That's a success. In 2023, there were 155 deaths, and 43 of them were related to HIV disease. Historically, the dark blue line was number 2. That was cancer. And then there was a light blue line here that was heart disease. And there's another darker blue, which is chronic lung disease, which is at the bottom. What has happened over the last several years is this green line, which represents overdose. And that's been increasing since 2017. And in 2023, there were 34 deaths related to overdose. And there were 9 additional non-overdose drug-related deaths. So 43, 34 plus 9. So depending on how you look at this, we now are in a situation where by 2023, 28% of all HIV or deaths among people with HIV were related to HIV disease, or 28% of all deaths in 2023 that related to people with HIV were drug-related deaths, 28%. So this is an unwelcome piece of news, also because people dying of overdose are 10 to 15 years younger than people dying of these other causes. The graphic here on the right, the bars, the height of the bars are the number of HIV diagnoses in Oregon each year. So back in 2014, there was 244 or something like that. And it had been going down. 2020 is an off year because of COVID. But then what we saw in 2022 and 2023 were clear increases. And that's been a problem. The other thing that we see here is that in this last period of time, the proportion of people injecting drugs who had, or diagnosed who reported injection drugs was inching up. In the last 5 years, 23% of HIV diagnoses reported a history of injection drug use. And then people not reporting injection drug use, but sex with a person who did, added another 9%. So 23 plus 9 is 32. And so we're seeing a lower bound of substance use that had direct relation to an IDU risk. 32% of diagnoses had an IDU risk or a risk associated with a person who of sex with a person who injected drugs. So this is not even looking at methamphetamine use or stimulant use related to added sex-related risk, non-injected drug use. Wanted to add too. Now this is something of a mention of comorbidity. When I look at HIV-related cases, diagnoses here, I can see that 10% of those people diagnosed in the last 5 years had been diagnosed with hepatitis C, chronic C. Of course, that's much higher among people who had reported injection drug use. Looking at syphilis over the last 5 years, again, the height of the bar represents both people reported with early to late syphilis. It doesn't include congenital syphilis, which is a infant born exposed to syphilis. So this is just early and late adult syphilis. And when we look at their reported risk, 12% of people reported over the last 5 years had reported injection drug use, and another 6% of people who did not report injection drug use reported sex with a person who injected drugs, or 18% of diagnoses had an IDU risk or sex with a person who injected risk. Again, this is a lower bound of substance use related risk. We can look at congenital syphilis by itself, and we did a study looking at the drivers of congenital syphilis between 2013 and 2021, and we did find injection drug use as a statistical driver of congenital syphilis. So injection drug use, correctional involvement, and county level socio-environmental challenges increased congenital syphilis risk among pregnant people with syphilis in Oregon. A link to that study is here. But we also do reviews of charts now, and we can see that over the last 5 years, since 2019 to 2023, the orange here represents pregnant person with substance use. So what we're seeing is at least 56% of birthing persons or pregnant persons of congenital syphilis cases reported substance use. And that's not just injection drug use. It's likely to be higher than this because not everybody gets interviewed, or not all drug use is recorded. The key points that I wanted to share with you today was that the syndemic approaches by definition require collaboration across disciplines, state and federal funders. That drug-related deaths are now a leading cause of death among people with HIV, and substance use contributes, of course, to HIV, Hep C, and syphilis infection. That seems obvious, but we used to emphasize this a whole lot more than we are today. If Oregon is going to address the infectious diseases in our substance use centered syndemic, we also need collaboration among clinicians, the Behavioral Health Division in terms of primary prevention, and the Behavioral Health Division folks doing prevention, harm reduction, treatment, and long-term recovery. So that's what I wanted to share with you today. And this is my contact information if you have follow-up questions. We have HIV-related data at this location if you wanted to look at some of that in data dashboards. Thank you very much.
Perfect, except for one thing on your last slide.
Yeah.
You said behavioral health twice instead of public health and behavioral health, and I know you wanted to make that point.
Oh, can we shall I hit the key points again?
We can, absolutely.
Okay, sorry. All right, are you marking the time or something?
I got it.
The key points that I wanted to drive home were that the syndemic approaches, by definition, require collaborations across disciplines, state and federal funders. That drug-related deaths are now a leading cause of death among people with HIV. And substance use contributes to HIV, hepatitis, and syphilis infection. And if Oregon is going to address the infectious diseases in our substance use centered syndemic, we need collaboration among clinicians, in the Public Health Division primary prevention interventions, and in the Behavioral Health Division in terms of prevention, harm reduction, treatment, and long-term recovery. Thank you. This is my contact information, and you can follow up with any question you might have at that email address, which I look at all the time, or respond to those phone calls. The data link here is to our data website, and you can access data dashboards at that location. Thanks again.